Katarina Graffman, and I work at Mentor Sweden. And what else?
No,
it's a small organization, NGO organization, that works with alcohol and violence prevention.
Okay. So you spent some time interviewing kinship carers and hearing them talk about what their needs are in Sweden. Tell us what they told you.
First of all, I'd like to say it was very interesting in making these interviews, kind of hard to get them. But one of the things that I really didn't expect to happen was when I interviewed them, that there was a lot of emotions that came up all the time. They were very willing to be interviewed, and I had very long interviews. It was face-to-face interviews, up to 2.5 hours with some of them. So it was really, I could see that it was a relief for them to be interviewed, and be interviewed by some not an authority or an organization, social services or anything like that. An ordinary person that was interested in their story.
Yeah, and so what did they say? What were the things that you found that they had difficulty with, or that they celebrated about being a kinship carer?
Most of them really, of course, they loved the children, so that wasn't the issue at all. They really loved the children, but there was struggles with the family members. Within the family, a lot of problems, and I can relate to that, because it's family that you love and hate, and there's a lot of these social-emotional issues that going wrong, and you don't know how to handle them, and you don't want to be cruel to them, but it's at the same time you want to teach them to do something and things like that. So there's a lot of emotions that are coming up, and it's both good and bad. I think the worst thing is they don't really know how to handle it. They should have some kind of help trying to sort it out, because if you don't do that, then they will probably go on and on for a good time, I think so.
Did you find that there was still a lot of stigma attached to their situation?
Yes, there is a lot of stigma attached to the situation of being a kinship carer. I think the biggest issue is that you are supposed to be a good parent. That is your role as an adult. As soon as you get children, you are going to do this well. And if you don't, then there's something spooky and something not really right about you, and that really is the stigma. And even though it's a social inheritance, you could say, because if there's somebody in your family that has a drug issue, you're looked upon as you all have this, and I think this is very Swedish also. We think that it runs in the family. Right.
And since doing those interviews, you've been trying to write a guide for carers. Why did you choose to write a guide?
I choose to write a guide because that was something that they were talking about. There's a lot of guides or handbooks or leaflets, but they are written for professionals, lots of them. And the thing that I thought, this is my interpretation of it, was they wanted something that you could have in their hands. There is that, do this, think about that, then go there, call them, say this, things like that. They wanted something easy, not the whole story, not telling everybody about what has happened before and things like that. What to do now, and something hands-on, really.
Yeah. No, I think that's come across in a number of the countries that we've been in, that those early days of being a carer can be very, very confusing indeed. So if there was a message, and this is my final question really, is if there was a message that you would want to take to the European Commission or to the policymakers in your own country, what do you think it would be about what you've learnt in this project so far?
I think the message is these are real people and they are struggling with a real problem and they're doing their best. Give them time and space.
Yeah. Thank you very much, Katarina.